Yeah, especially, it goes against our Hippocratic oath to do no harm. And for these doctors to continue to push it and they incentivize it. I always say, why do you have to incentivize something that works? They
Exactly.
were giving out free meals and money and everything else to folks to try to get them to take this. And you're just kind of thinking and scratch your head like, where'd all the common sense go? I mean, even when the CDC even changed the definition on their own website of what a vaccine truly is, I had the screenshots of the before and after. I'm just like, how can people just not see what's going on? I worked in the pharmaceutical industry where I worked in a research facility where we tested many, many different medications and vaccines on animals. And, those studies and the millions and millions of dollars put in those studies, I mean, it's years and years of data and research before it even gets to clinical trials. And then they look at all that data and there was none done on this procedure.
Right. Well, they just want to get that mRNA technology out there, and it's too big to fail. They've invested so much time, I mean, not time, money and
Time and money.
ego.
Yep.
Yeah, we need more time.
Yep.
But they've invested too much to admit that it might have been a mistake, or admit that it certainly is a mistake.
And it's costing people's lives, quality of life, and everything else. You mentioned the mRNA. Can you go into kind of like the science a little bit with how it is? What was their intent with this thing, and why is it like I read some research on it just a couple days ago about how it's like creating autoimmune disorders,
Right.
possibly. So can
Well,
you go into the science of why that's happening and how it was supposed to work?
Well, it's not natural mRNA. It's modified mRNA. It has a modification on there that keeps it from, breaking down in your body. It's delivered in a way that, evades the normal body's response to degrade it. So it's purposely delivered in a way that it gets into your cells, it gets distributed throughout your entire body, and then it creates this spike protein. So you're implanting a system in your body that is a protein factory, and there's no off switch, right? So it was, we were told that it would just stay in the arm. It would briefly create spike protein enough to create an immune response, and then that's all there is. But that's not what happened, right? It went throughout the entire body. And like I said, there's no off switch. Now, I think that a lot of these shots were probably inert because the storage requirements were so stringent. Like if I had wanted to distribute the shots, I would have had to buy a very specialized, expensive piece of equipment, which most people weren't doing. And these people that went to the stadium and stood in line for an hour in their car, and it was 90 degrees outside, I have a hard time believing that they actually got the true product that was intended. So I don't think everybody needs to panic. But we're messing around with DNA. It is definitely a gene therapy product, but it's being described and presented as something, as a vaccine, which it's not. If it were truly, if they would admit that it was a gene therapy product, the the safety requirements would be much, much higher. So there's a reason that they're not doing that, even though it's perfectly obvious to anybody with, you don't need to have an MD or PhD. Common sense, this is a gene therapy product.
Wow, I didn't think of that angle. So if this would have been, basically it's a therapeutic, right? So if they would have advertised it as such and people would have started having side effects, could they sue the pharmaceutical industry for those side effects?
I don't know the legal aspect of that, but it seems to me that it might evade the Vaccine Injury Act.
Yeah, I think that's probably why they labeled it a vaccine because they wouldn't have any liability with it. I mean that's good marketing on their part.
Exactly.
I
And
mean,
they needed to change the definition of a vaccine so that it would truly fit, right?
yeah, absolutely. So they wouldn't have any liability and they can just continue to print money for themselves. What made you start this petition and when did you start it?
Well, I stumbled upon a post from Brad Paquette, who's a state legislator in Michigan. And he was describing his vaccine injury. He suffered myocarditis after the shot. He was actually hospitalized. He's young. He was otherwise healthy. And then I asked him, would you be willing to publicly state that the COVID shot should be pulled off the market? And he wholeheartedly responded yes. And then that kind of gave me the courage to ask more people. And it just grew organically from there. It's just all from X, right? And it's just over the last 3 months, it's gone from one person to now 200. And I think we're up to 245 people.